So quickly defining heart disease. Heart disease is a term that a lot of people use. We're all universally afraid of it, as we should be. It's the number one killer of human beings. Kind of always has been, likely always will be, unless we have some profound breakthrough in behaviors, society, and science all at the same time. But essentially, heart disease at the highest level is a process of atherosclerosis, which is a hardening of arterial walls. Arterial walls are arteries that carry oxygenated blood to tissue, and it's the life source of being a human. So all tissue needs oxygen. Oxygen comes through blood, and blood travels through arteries. And when those arteries harden and they become enclosed through atherosclerosis, eventually plaques can form, minimizing blood flow. And where it gets really, really scary is where these plaques are unstable as they're forming. They can break off, and fragments can go downstream and get lodged in smaller arterioles and then stop all blood flow downstream, and that tissue dies. If that happens in the heart, we call that a heart attack. If it happens in the brain, we call it a stroke. I think part of the challenge of the old way of looking at heart disease is that you either have it or you don't. But the greater problem than that is the whole you either have a disease or you don't have a disease. And one of the things we talk about is the disease spectrum. All diseases exist on a spectrum. The question isn't, do you have this disease spectrum? The question should be, where on the spectrum are you?
Right.
By taking a very defensive posture, which is our old way of heart disease, we wait until there are symptoms, and then we do something about it. And the problem with that is that by the time there are symptoms, by definition, you've got advanced disease. And this is why, after all of the years, all of the science, all of the breakthrough, all of the knowledge, we still aren't any closer to solving the preventing heart disease ambition than we were 25, 30 years ago, because we're taking a defensive posture. And we, you and I, and a group of other like-minded healthcare providers, I believe, are taking a much different approach than this defensive-minded mindset when it comes to killers of human beings. And to be honest, without a fresh approach, you will be managed in a defensive mindset, and it likely will lead to a non-ideal outcome when it comes to heart disease.